Hello, everybody. I want to welcome everyone into the room. If you do not want to be on camera, please note that this is being recorded. So I ask that you just take yourself off of camera and remain muted throughout the presentation or throughout the panel. At the end, we will offer the opportunity for there to be questions. I like to leave at least 20 minutes for audience participation Q&A. We have the panelists here, Hannah, Terry, Ina, and Eveline, and I myself will be facilitating the discussion. I want to welcome y'all here to the Herpes Patient Provider panel. I saw that things just changed on Zoom. All right, that threw me off a little bit, but we're here. Welcome you all. I am Courtney Brame. I use he, him pronouns. I'm the founder, executive director, podcast host of Something Positive for Positive People, which is a 501c3 nonprofit organization supporting people who are navigating herpes stigma. And today what we're here for is to just really speak at the intersection of the patient-provider experience as it relates to herpes and herpes stigma. Herpes Cure Advocacy conducted a survey in February 2025 where we had 338 complete responses in relation to stigma and the interactions between patients and providers. So this conversation will be really about more expanding on what some of the survey findings have shown just through the experiences of our panelists that we have here. So I want to first open with just a brief introduction from everyone. We can just go down the line real quick. I'd like everyone to just introduce yourself, name, pronouns, and what your job title is. And Hannah, I'll have you go last because then we'll just transition into it. All right. All right. So we can start with Terry.
Hi, everybody. My name is Terry Warren. I'm a nurse practitioner. I also have a master's degree in counseling, so herpes and counseling together are a great fit. I ran a private sexual health clinic for 33 years, and now I see patients via telehealth, help people with diagnostic concerns. I do a lot of couples counseling of discordant couples, and I'm really pleased to be here.
Next, can we get Eveline?
Hi, I am Dr. Eveline Dacker, and I'm a board-certified family practice doctor, but I specialize in sexual medicine, women's health care, and I have a special interest in STIs and communicating how to discuss sexual health issues. Thank you.
All right, Ina.
Dr. Ina Park. I am a professor at the University of California, San Francisco in the School of Medicine. I'm a family physician as well, just like Eveline, and I'm also in the Department of OBGYN, and I am a medical consultant for CDC STD division, and I work on their treatment guidelines, and that's what we're working on actually right now. I'm excited to be here.
All right. Thank you all for making the time to come and contribute to this important conversation. Hannah, I would like for you to please introduce yourself however you feel most comfortable doing so.
So my name's Hannah. Pronouns are she, her. And kind of a little bit about me. So when I first noticed I had symptoms, I personally thought I had hemorrhoids. And my pain was it was so bad I ended up wearing diapers. And so I did end up reaching out to my sister, which is a midwife. And she said it looked like herpes, so I should probably go to the OBGYN. So I actually did go to the gynecologist at that time. And my doctor actually was very supportive. She said it was very common, it's manageable, and there's nothing to be ashamed of. She told me that there's podcasts out there. And so I had a lot of support at that time when I was first diagnosed.
Yeah. Well, thank you. You jumped right into it. I was just going to ask what your experience was.
Sorry, I thought that's what you wanted me to do. My
No,
apologies.
you're good. You're good. Can you speak a little bit about that experience that you had with your healthcare professional? And one of the reasons that I ask is we're looking at, sometimes the perceived judgment from a provider. One of the survey stats that we have here is that really only 23.3% of people felt that they were judged or stigmatized directly by their provider, but 45.9% of people believe that herpes stigma in healthcare settings are very or somewhat common. And I want to know if you had any experience with that when you received your diagnosis.
Yeah, when I received it, I did not. I only dealt with one doctor, and she was just very compassionate at the time. Um, can I speak on my sister's experience? Because hers was a little bit more traumatic. Um,
Yeah, sure, please.
Okay. So she thought she had it on her mouth, and she went to just like a clinic, and they were like, "Yep, you have herpes." And they were very like just cold about it. She left the room. My sister started crying. She came back in and she's like, "Why are you crying?" And like that made me understand that there was more stigma around herpes than what I dealt with initially when I first found out.
Mm. Yeah, well, thank you for sharing that. One of the things that we see consistently throughout people's experiences with herpes is just this interconnectedness of sexual health and mental health. And Terry, I'll go ahead and shift over to you. From your experience with counseling people, especially discordant couples, I'm just curious, what are some things that you see from the psychological and emotional perspective working with patients?
Yeah, I think there are probably several reasons that herpes is difficult, but in the patients that I see, the biggest concern that I see is transmission. So if the most intimate thing that you can do with another person is to give them a lifelong, highly stigmatized, sexually transmitted infection, that carries a lot of weight and a lot of fear and shame and negative emotions. So when I see discordant couples, I think the couples that I see are motivated that they would both show up on a telehealth visit with me and ask a lot of questions. The uninfected people that I see are generally concerned, are wanting to know what they can do to avoid transmission or what happens if they do get infected. But the partners that are infected in these video calls are frequently crying, are hanging their heads. They feel sometimes kind of one down. And I try to remind people everybody brings some shit to relationships. I'm sure my husband could list, I have a long list. And when I met him, I tested him for everything and he was positive for HSV2. Didn't know it. And after 25 years of lots of sex and Valtrex once a day for him, I have never gotten it. And I tell patients that a lot, like, there are things that you can do. This is not an automatic thing that happens that you transmit. But you walk into this with awareness and agreement, and the person who's infected can only do so much to protect you. We talk about the things that they can do, but that you need to walk into this with your eyes open and in agreement that this is something that you are aware of and are willing to engage in, that this is your decision, and to take your time and think about it and read and learn and talk with each other about it, that this is nothing that people need to be ashamed of. Most people acquire herpes without even knowing that their partner's infected. And most times their partner doesn't know that they're infected. So stigma's tough, and you're wearing a shirt, so you know a lot about stigma. Yay, there you are. But it's an emotionally hard thing. My experience has been that if people have a good clinician at the diagnostic experience, that it makes a huge difference in how you see this infection going forward. That if you are brushed off, if you are rushed out of the room, if you are not given very much information, if you get the message, however subtle, that this is something they really don't want to deal with, then you integrate those feelings into your heart and you take them with you as you deal with this disease going forward. So if we have clinicians that can be sensitive, kind, empathetic, knowledgeable, willing to take time makes a huge difference.
Yeah, thank you. The way that you just spoke, I have like four different angles to take, but the one that's speaking to me now the most is to direct it over to you, Ina, first. We hear about the mental, emotional impacts, like Terry said. She'll see
Mhm.
patients crying over the camera and
Yeah.
have these terrible experiences. We've been at conferences together, and consistently outside of what we presented together at the STI World Congress, herpes isn't a priority in the public health space.
Mhm.
Uh, do you have anything to say about that?
I mean, how much time do you have, Courtney? Um, I think, yeah, herpes has suffered very much from a lack of attention. And I think part of it, which, Terry can be actually the first person to talk about this and can talk about it even more deeply than I am, is that, our diagnostics for herpes, if you actually have a lesion, are great. And if you're actually just trying to screen people in the population, are terrible. And so I think, folks in public health, I'm also a clinician and I see patients, with herpes and other STIs, but wearing my public health hat, I think there's been a huge reluctance on the part of health agencies to do any sort of active surveillance for herpes because we know that the serology test or blood test for herpes can be highly inaccurate. It can give a lot of false positives, especially if you get a low positive value. So I think that that's part of it. And I think because the community of people living with herpes has been so stigmatized, I would say, in the recent past, now people have become more active and the advocacy voice is much stronger. But in the past, also people didn't want to talk about it, and so I think that there was not much attention paid to it because it wasn't like an infection with HIV where there was a huge community and outcry of support and advocacy. So I think, part of the issue is the diagnostics being lousy and not having a lot of faith in them. And then part of it is a lack of advocacy. But I want to say that since we're doing the new treatment guidelines, there are quite a few new blood tests that are much, much better in terms of their performance. So I feel like in the coming years, we have a great opportunity to actually resume the advocacy for greater awareness around HSV.
Yeah, thank you for that. Now we talk about Terry. You mentioned the quality of the provider essentially being something helpful, and then I know we know that uh, we're seeing that we're getting better testing. We're getting more of the advocacy is bringing people's awareness to herpes. And Eveline, I want to speak to you specifically about the importance of the education piece, not only what providers need for themselves, but also, I know you say this often that herpes is essentially transmitted infection as well. And there's a lot of just communication that has to happen. So I want to have you speak on two things. One is just the quality of education that providers receive, especially in schooling, and then the communication piece in regards to how to talk to patients about this.
Yeah, thank you. I could speak to how well medical providers, and I'm including all medical providers, are taught about STIs in general and sexuality. It's like a very small piece of our education, if anything. And maybe STIs will get 30 minutes of a lecture and then we kind of go on. I'm hoping that it changes a little bit with the newer generation. I think that, you know, with the advent of sexuality being so much more discussed, there's a little bit more awareness of it in the younger providers and people coming out of school. So I feel hopeful. Just like Ina said, like testing is changing, things are changing, but still, it's not like we're taught very much. And oftentimes I have to say, like, what doctors do is when they get something like this, they go to like Up to Date, which is a place where we look for information, and or CDC, and we just say whatever is told to us to say. Uh, so really, a lot of it is also about empathy. Like, how well do we listen? How well are we able to be empathetic with the people who we're sitting in front of us? So that, again, wasn't taught very well when I was in medical school many years ago, but I think it's getting a little bit better. But regarding like STIs, we're taught a lot about HIV and maybe syphilis, but herpes is really under recognized. And one thing I really want to say is that one of the reasons I think herpes is so under recognized is because it's sort of a metaphor for our overall sex negativity. Because herpes is not just a sexually transmitted, but also sensually means, which I mean skin to skin contact. We tend to not want to like deal with it as much until it's in our, right there, and we have to. Does that answer your question? I hope so.
Yes, yes, it does. And Hannah, I want to ask you, going back to your own personal experience as well as the experience that your sister had, are there any improvements that you would like to see, I guess, most immediately in terms of how providers engage with patients? It sounds like you had a fairly positive experience and your sister had more of a blunt, or would she say negative experience. Based on the spectrum that you've seen, what are some things that you would like to see improvements on?
Um, well, let's see. Starting off with what Evelyn said is empathy is probably one of the main things is just having that. And also just having the knowledge of it. I've had a personal experience as well as when my sister had it, ended up being a mango reaction. It wasn't even herpes. So yeah, she found out days later, and so I don't think they actually tested her for it. They just looked at it and said it looks like herpes. So having the knowledge, and then also I had an experience where I didn't know if I had HSV1 or I had two, and so I went to the doctor, and I had my doctor call me and tell me it was two, and I was like, "Oh, good to know." I was like, I didn't know if it was one or two, and she's like, what'd she say? She told me that if it's HSV1, it's on your mouth. If it's HSV2, it's down below. And just, I obviously knew that wasn't right either. So just having the knowledge as well is a big deal.
I think everyone shook their head. Did anyone want to say anything about that? I have something to say, but I want to keep the flow of the room going. Terry, you're unmuted.
Oh, I missed a little bit of what you said, Hannah. Go ahead, Courtney, you respond, and I'm
Well, yeah, my thing about because I think back to even when I was diagnosed, I was given a visual examination on my penis and told that that was HSV2, only to learn much later that we are seeing many more HSV1 genital cases as well. So this was before I was given a test. The doctor just looked and said, "Hey, that's type 2 based on location." And I think that this is something that contributes to a lot of the stigma that people face because they might not even know which type they have, and it's just being given to them based on the location. But we know that you can have type 2 orally or genitally, or type, you can have either type in either location. And I saw everyone was shaking their heads. Oh, go ahead. Go ahead.
I was just gonna say when Hannah was talking about her sister getting a rash around the mouth from mangoes, because I get that same thing, is that we get it wrong when we try to guess just from looking at somebody what they have. And I just think everyone's shaking their head because this is so important. We have excellent PCR tests. There's no reason why people should be guessing. And, if you have a lesion that, and the thing is contact dermatitis, which poison oak and this mango rash or whatever can mimic herpes, get a PCR test and don't guess and tell someone that they have a diagnosis that ends up being wrong. I just can't believe that happened. Well, actually, I can believe that happened, but it's sad.
And I think it's really important in relationships that people believe to be monogamous, that people in a completely monogamous, lifetime monogamous relationship can get genital herpes that's HSV1. I remember that I had a young Mormon couple in my office. They had just come back from their honeymoon, and she had a raging first episode of herpes with, I bet, 50 or 60 lesions genitally. And in their relationship, it was like, you were not a virgin when I married you. And she was like, yes, I was. And then I said, so did you engage in oral sex on your honeymoon? Apparently, this was something that they weren't supposed to have done. And they said, well, yes. And I asked him, do you ever get cold sores? Oh, about 3 times a year. and her swab was positive for one, and it made a huge difference that they had that knowledge that this was not somebody else. This was within their own relationship. And without typing, we're lost to help that kind of situation.
I also just want to pipe up here too that I have diagnosed genital shingles, which is herpes zoster. It's a different strain of herpes, but you kind of have to test and think outside the box. You cannot just think, oh, this is just typical herpes simplex.
I wanted to shift the conversation into testing, but I'm saying we have a lot of questions that are popping up in the chat. So if y'all are okay with me just kind of audibling a little bit and we can come back to the questions that I have, I think that it's most important for the people who are in attendance to be able to get their questions answered.
And I'm sorry, I popped in some answers to a few of them while
Oh,
folks were talking, but
great. I'm so happy that you did that. Thank you so much. So I'll go from most recent here. There's a question about, isn't HSV-1 genital more manageable than HSV-2 genital? Does anyone want to answer this question? Now, I'm happy to. Just in conversations that I have with people, the phrase manageable, we have to really look at what that means, right? Are we talking about frequency of outbreaks? Are we talking about the duration of outbreaks? Are we talking about responsiveness to medications? There's a lot more to factor in there, but herpes is herpes. And I think that when we're looking at a genital HSV diagnosis, we're looking at not just the physical reactions and the pain or the annoyance of it. We're also looking at our relationship to sex and relationships, right? So it also impacts your sex life or how you are engaging in relationships. So between the type, how manageable it is or more manageable is a person to person thing. So yeah, if you want to elaborate more or write a little bit more about your question, and maybe we can be able to give you a better answer than what I just gave. Terry, you unmuted. Did you have anything to add?
Sure. So I would say that HSV-1 genital infection recurs less often by a huge margin, is transmitted through intercourse uncommonly. And because about half the adults in the US now test positive for HSV-1, the likelihood that you'll be having sex with someone who's already infected is a 50-50 shot. So I think the problem is that if you tell somebody you have genital herpes, but it's type 1, when you use the word herpes, I think that just scares people. So I think that if you say, I have, you can say you have genital herpes, and you can say I have the cold sore virus genitally. We know that by the time somebody's been infected for 2 years, they shed virus on about 4 days out of 365. So it's a completely different infection than HSV-2 genitally. And I think it's important to be able to get your foot in the door enough when you're disclosing this to be able to elaborate a little bit and hope that somebody is really listening.
I know you mentioned the PCR test and someone had a question. What is that? And are they easy to get?
they are quite easy to get. So I think probably most people in the audience remember during COVID when people were, swabbing your nose for, before we had the at-home test, people had to get tests. And these are PCR tests, so they amplify whatever genetic material might be present. So it can be done for COVID, it can be done for herpes simplex. And so it's a swab usually of a lesion that will give you a specific diagnosis of whether or not that lesion is caused by HSV-1 or HSV-2. And, there's a little bit of a question going on in the chat because people were wondering, well, could we just do a random oral swab for somebody, for example, who had a positive blood test but never had symptoms, to see if they were carrying HSV in their mouth? The swabs and those PCR tests were meant to be used actually on open sores or lesions. So I actually don't know how sensitive they would be and how accurate they would be if you were just to randomly swab somebody's mouth. So it's not a way that we use it at our sexual health clinic. I don't know if Terry or Evelyn, can comment, but, people sometimes do swabs like that out in research studies, but in terms of the clinically available swabs, typically we're just doing them on open sores.
But there is a site called 24/7 Lab Kit where people can send for their own PCR swabs and do them at home. And I've had some patients who have swabbed. I had one patient swab for an entire year doing daily home swabbing. Obviously, they had a lot of money to be able to do
Right.
this, but you can get those swabs. And I encourage people to utilize them when they have had a diagnosis, but they through a blood test, but don't have any outbreaks, but they have things that they wonder, is this herpes? Is that herpes? And if those swabs are at home with you, then you can get that swab quicker at home than try to make an appointment and get fit in and get the right test, PCR, not culture. So I think utilizing those at home can be a big help.
But Terry, they were swabbing like something that they thought could maybe be herpes, even if it was just like a little, tiny tear or something like
Like a
that.
ditzel.
Yeah, ditzel. Yeah.
The patient that swabbed for a year just used the protocol that we use in our daily home swabbing studies.
Got it.
Did that for a whole year, didn't recover virus once.
Yeah.
There were two questions here that I wanted to touch on in the chat, and something popped up and I lost it. Where to go? Not forget about it. It was about the testing, the commonality of false positives. And I'm curious I guess to just directly ask this person's question, how common is it to have a negative HSV2 IgG after a year of being diagnosed with a lesion? I'm not quite sure if the person who wrote that in, if you can elaborate, please. But it looks like Ina, Terry, y'all have the answer to this.
So I think that if you're taking daily antivirals from the first infection, that you can definitely not have a positive IgG. I just got finished talking with Greg Pepper at the University of Washington that does the Western blots, and he said our biggest thing, this happens, and people are on daily antivirals from the get-go. If it's working really well, your immune system can't see the virus and cannot make an immune response appropriately.
Yeah.
I have had two patients. One went 9 months. We pulled her off suppression and she made antibody 2 years. And so I think it can happen, but the
Yep.
IgG test also misses a certain amount of herpes, especially HSV1. So the Western blot would be appropriate in that situation.
I've
And
also seen
can you
people delayed for months who were positive on a PCR and they went on suppression right away and they did not develop antibodies for many months.
speak to the Western blot? Like, I've heard about the Western blot, and it's just one of the types of tests. Or can we share the different types of tests there are and the best time to use them?
So the Western blot, a lot of what I do is help people get Western blots or order them for them. This is a test where the IgG test looks for a single antibody protein that's different between type 1 and type 2. The Western blot looks for all 16 antibody proteins, and 4 of them have to be present to be called positive. So that eliminates the possibility of a false positive. When you're looking at a test like diasorin, which Quest uses still, the rate of false positives, if the index value falls between 1.1 and 3, is 50%. So that's pretty damn high in my book. Now, LabCorp is using the new Roche test, and I keep track of everybody who comes to me for a Western blot and their IgG results and the lab that did them. I have not seen one false positive Roche since I started doing this, and I think I have almost 50 now. But Quest, I have routinely false positives, and the inhibition assay false positives 29% compared to Western blot.
Yeah, and that's Quest's confirmatory assay, but it gives also a lot of false positives.
And is there a best time to test? I always share with people the best time is to test when you're having an active outbreak. But is there something else to consider with that?
I don't think that the blood test matters if you're having an active outbreak or not, but we know that by 3 weeks from infection, 50% of people who are going to make antibody will have done so. By 6 weeks, 70% on the IgG test. But for the Western blot, you need to wait 12 weeks to do the test for greatest accuracy. Most people will make antibody before that, but I always have patients wait 12 weeks just because if they wait 11 weeks, then they write to me 3 months later and say, I think I better do it again because I didn't wait long enough. So 12 weeks for blot. And I would say, what do you think, Ina? Evelyn, 10 weeks for an IgG, maybe?
Yeah, I mean, CDC decided to just say 12 weeks for everybody because then, do you know what I mean?
Here.
Then you're capturing anyone who's going to make antibody in that window. And then, of course, if somebody went on suppression right away, that window could be delayed. But if you didn't go on suppression, that's why CDC decided to harmonize and just make that 12 weeks for everybody. If you think you got exposed, wait 12 weeks and then get tested.
Okay. Shifting gears real quick. So I'm seeing a lot of engagement in the chat. Yay. Thank you, everybody. But I want to make sure that we also stay on the topic of the intersection of the patient and provider experience. Terry, earlier you said that transmission has been one of the larger concerns of patients that you consulted. And I know that Eveline, a lot of your work and a lot of what we've done together is really supporting patients in navigating these conversations with partners. And you have a really wonderful framework, not work frame, to support patients in being able to talk about sex and sexual health that you teach to educators, therapists, providers. Can you speak a little bit about that and its usefulness in talking about sexual health?
Yes. So I created, because I see so many patients who are navigating this, I thought we needed to have some sort of, we needed to have, sorry, we need to have some sort of way of framing it to make it simpler. So I created an acronym basically for my patients to discuss sexuality with their partners. And it's called the STARS Talk. And it's an acronym to help remind us what we need to kind of consider within ourselves and also what we should discuss with our patients. And you could maybe put in the chat the Make Time for the Talk link, and it's called the STARS Talk. And the first S stands for safety. What are our safety needs around sexuality? What are our safety needs for ourselves? The next one is our turn-ons, what we want, what brings us pleasure. The next one's A, which is avoids, what we don't want, trauma. The R is our relationship intentions and expectations. And then the very last one is our sexual health and STI status. And this is a bigger talk than just herpes, but really I like to say that we don't need to put our diagnosis and our issues forward. It's not like we are not herpes. We're so much more than that. And I constantly, I'm telling you, does not define you. There's so many other things to discuss and to navigate. So when I help counsel my patients on how to discuss this with their partners or even potential partners in the future, it's always first of all, do you feel safe in that relationship? Is it somebody that you want to disclose to? Because if you don't, then you don't even need to go down any of the conversation. And then starting off with a positive. What is it that you like? What is it that you want? And I don't mean just sexual turn-ons. It could be anything in life. And then what is it that you don't want? And then, it's also very important to discuss why we're here together and why we're doing what we're doing. So what are our intentions? And then at the very end, that's where when you feel safe and you kind of have a connection, you can actually start that conversation of well, in my history, I have X, Y, and Z. I also use this a lot for my patients with HPV because I see a lot of women with HPV, human papillomavirus. And so again, sometimes we get these diagnoses and then we feel like that becomes us. We become that and we cannot get out of that. And if we want to start any sexual relationship, that defines us in our sexuality. So the STARS Talk really is to kind of help decenter it and recognize that we are so much more than that.
Thank you. And the reason that I wanted you to share that is because, again, this is one of the biggest issues that by the time people get to me, this is what their concerns are. How do I talk about this to partners? And I do believe that maybe upon diagnosis or in education, this may be where they can be presented with information like this. And I think that we maybe don't prevent STIs, but we absolutely minimize the possibility of transmission through communication and being able to talk about it, as well as minimize some of these long-term psychological and emotional impacts when someone does receive a diagnosis, because they're already more versed in having these kinds of conversations about their sexual health. So thank you for sharing the STARS talk. Ina, I see you got your hand up.
Yeah, I just wanted to comment. I feel like Evelyn's framework is so important, just because I wanted to mention two, like I saw two patients with HSV in the past 2 weeks, and small sample size, but both of them were definitely willing to take suppression, etc. But neither one of them was planning on telling future partners. And I'm like, oh no, is this like a new trend that people, because I have always emphasized, like, if you know your status, you should share it with partners. But it was very interesting. These two individuals were, happy to take suppression and do what they could, and happy to try and use barriers, you know what I mean, to help reduce transmission, but they didn't want to have the disclosure conversation, and we're not planning to with future partners. And I just think that that fear of rejection and stigma is still really, really strong. And I just wanted to point that out there, because I hadn't heard somebody say that directly to me before.
And I saw that you unmuted.
Yeah, so I did a podcast about herpes a while ago, and I had a guest come on our show and our podcast, and said that they were told by the doctor to not disclose. And I've seen that on Reddit a lot, for doctors to tell them not to. And I feel like that's wrong, but that's just my opinion.
So that is fairly common. Unfortunately, I speak to the experience of someone that shared with me on a podcast episode that I did with them. She was sexually assaulted, and at the time, she had a recent partner that she was with, and then there was the person who assaulted her, and she asked her most recent partner to just go get tested for herpes, and he went to get tested, and his doctor denied him. He was just like, "Oh, just wear condoms. You don't have anything to worry about." And so it was difficult for him to get tested, even sharing, "Hey, I have a partner who told me that she was recently exposed." And the doctor is just like, "Just wear condoms. Don't worry about it if you don't have any symptoms." And these are the kinds of things that I hear more about when a person does try to get tested for herpes. It's very downplayed and it's dismissed to the person that wants the test done, rather than them just being informed of, okay, well, we don't recommend it because dot, dot, dot. And I think that this speaks to the challenges of communicating about not just sexual health, but also just even with the testing, and how misinformed or the lack of education that maybe some providers have. So yeah, that's it's an unfortunate place that we're in at this time. I think this is a quick one. I know you had highlighted here. What is Pertilavir? Pertilavir, is this the medication that is available for people who might be going through chemo or are immunocompromised? That's only available for them.
There's a clinical trial. Yeah, so Courtney, at the recent World Congress meeting that we were at, the manufacturers of Pertelavir were there, and they just finished enrolling for a phase 3 clinical trial, which, for those who are patients in the audience or who are not in the research world, you have to go through multiple stages of clinical trials before a drug can be FDA approved for use. And so Pertelavir is now going to be is actually in a phase 3 clinical trial. And that would be, it's an antiviral that has activity against herpes, and they're testing it first among people who can't take the usual antibiotics that we have, acyclovir or valacyclovir. So for people who have a resistant organism, they're getting Pertelavir. If the drug works for resistant, acyclovir resistant herpes, then it will get FDA approved for that purpose. But once it's FDA approved, people could use it, what they call off-label, but providers could prescribe it for other reasons. So they could prescribe it for suppression, they could prescribe it for treatment, but at least initially, the first kind of indication or labeling on what I was going to say for acyclovir resistant herpes only. But the company, I'm sure, has met with Terry and met with me and was asking whether or not folks thought that it would be useful to have another agent out there for suppression, and whether or not they should do a suppression study as well. And I definitely think that that would be a great idea. And it may, based on their preliminary data, it may suppress the virus even better than acyclovir and valacyclovir. And please, Evelyn and Terry, correct me if you've heard anything different.
Well, when we did the preliminary study before the FDA cut it off, it was demonstrated to be better than Valtrex. So I think that's important. And the other thing is the Assembly Biosciences data has just been released, and that looks just like a rock star. 94% reduction in shedding and 98% reduction in high volume shedding. And I think 94% reduction also in recurrences. So that's going to be a very interesting drug. And they did once a week dosing, and they're going to look at once a month dosing. So it's all really, there's so many exciting things going on right now with herpes. It's like, whoa, gene editing and these two helicase primase inhibitors and so it's just really happening.
I think imagine what it would be like if you could go to your partner and say, yes, I have HSV, but I'm taking something that suppresses, over 95% of the virus. I really can't give it to you. Then we'd be in a situation like we are with HIV, where really there's a lot of mixing between positive and negative folks because people are not as afraid of transmission. It would be, it'd be astronomical, be huge.
Yeah, the advancements in medication testing, how quickly we can find out if someone does have HIV and get them on meds and to the undetectable status. I like to think that maybe with advocacy efforts, with events like this and people showing up, that we're working towards something like that. And I wanted to address, so more chats are popping up. Someone said, if our goal is to raise awareness and counter misinformation about herpes, which is on the topic, why do we still use intimidating and frightening language like disclose and disease? So I have used the word disclose. I don't like that word. It's a discussion, but for everyone, the general population, I use the word disclose to draw people in, and then we can hit them with a raw gotcha. Actually, we're having a discussion, right? Because yes, disclose does feel stigmatizing. We disclose for legal documents, right? We're talking about disclosure agreements, but there's other language like that maybe we may not recognize as stigmatizing. So the word prevent. I don't use the word prevention. Earlier, I used the word even minimization, like how communication helps to minimize the impacts of stigma. When we look at words like safe or protection, we can only be more safe. We can be safer. And instead of protection, we just call what our precautions are. Are we taking medication? Are we using barriers, condoms, dental dams? What these are, this is an active thing. So I apologize if I wasn't more cognizant of the language that I was using in managing the space, because I know that we're interchangeably using various language for this particular audience that we're in. Speaking of advocacy efforts, so Ina, I would like to ask you, what are some early outcome shifts that we can collectively work towards? I know our overall goal here is it would be lovely to just have a cure. That's not what's going to happen today. What are action steps that we can see ourselves on the trajectory towards to maybe work toward getting to a cure, rather than that being like step 10? What are steps, 1 through 5 that we can do now to have some sort of influence in the public health setting?
I mean, I think personally what I'm looking towards is, when the new guidelines for STIs come out from CDC and do include better testing options that, have less false positives, my personal advocacy goal is to really try to increase testing and get more people aware of their status. And then I also think as you and Evelyn have brought up really well, is that then and then encouraging people to have discussions with their partners, not just about this, because STI status is one tiny little part of your sexuality, and then constantly reframing as well for people who I'm giving a diagnosis to about, people then start to integrate like having an STI as part of their identity when really, do you know what I mean? It's not, and that they undergo an identity crisis. So I think, but first thing I'm going to do is when we have more sort of guidelines, including these better performing tests, I'm really going to strongly encourage people to use them and for more people to know their status.
So Ina, do you think that we'll get to a place where we can again recommend that people get tested? Because I know that now, I submitted 700 false positives to the FDA.
Yep.
I said, would you please remove these tests from the market? And their response was to send out that letter to all clinicians, making them aware of that. But do you think that we'll get to a place with these better tests, this Roche test, there's others that are good. Do you think we'll get to a place again where we can recommend herpes testing as part of an STI screen?
I mean, if I can become queen of the world, then absolutely. I feel like we could
Let's
get there.
make you queen.
Yeah, I feel, I'm very hopeful compared to the performance that we've had in the past. I think we're doing this new generation of tests is much better. So I'm feeling like we're moving towards that in combination with, as you both know, the PCR test, which I feel very confident in. I think we are going to see a shift. Now, whether or not we're going to be able to say every sexually active person gets a test for herpes, that's going to take a while, but I feel like I can see a path forward to getting more testing recommended.
One more question that came up in regards to resources. So looking at the survey from February, only 10.8% of people found herpes specific educational resources very or somewhat accessible through their provider. And then 64.1% said that they were not at all or not very accessible at all. What are some ways that there's a lot of advocacy and activism that we're seeing more on social media, on Reddit, in all kinds of online spaces that's being done? How can we partner with clinicians to get more of these educational resources out there? What's currently being shared? And this is for anyone who wants to just jump in and answer, sharing what they share with patients. Go ahead.
Actually, well, first of all, I do share your podcast, by the way, Courtney, with a lot of patients. But I'm curious for Hannah, where did you go to online if you did any reading about HSV, and what did you like? Because I would love to know if you found anything helpful.
Ooh, when I first started, she told me about podcasts, my OBGYN, and she did give me a pamphlet, but I was so distraught, I didn't read it. But oh shoot, I forgot where my brain was going. What was your question again?
Did you find any folks on social media that you found had good information, or any like websites that you particularly liked? Because I think it would be great for us. He was asking, what do you share with your patients? Well, I'm like, well, let's find out what Hannah likes, if she likes anything.
Yeah, Life with Herpes was like I listened to that like day in and day out when I was going through it. And that podcast really helped me. It was really the only one I knew about. I know she's hasn't really done many recent ones, I don't think, but yeah, she was very helpful to listen to.
And there's also social media accounts. So I tried to write the podcast that I know off the top of my head. I know that Aaron's in here. So shout out to Aaron from the Herpes Dirt podcast. If you can link that in here as well. And what I found to be useful to people has just been hearing the stories and experiences of people living with herpes, because those pamphlets, right, Hannah, you mentioned getting the pamphlet, and you can just nod your head. Was that something that was useful to you to see how many people had herpes in the world? And I have the same experience. It doesn't matter to me that this high number of people have herpes, because I don't know any of them. So in some cases, it can make someone feel even more alone. but that's the only information that we have. So to be able to really humanize people who have this virus rather than locking our identities into, oh my God, now we're just another statistic. I think that the empathy from our healthcare providers, the healthy communication, the advocacy, the awareness of what resources and tools are available to us, this really does help us to be able to take the action steps necessary to work towards better treatment, better testing, general acceptance from our allies and support and people who are just unaware, because a lot of us don't really become herpes experts until we get it, and now it's like, oh, we know everything about it now, but we don't have to until we have to. So go ahead, Evelyn.
Yeah, I just want to jump in that, like, for me, I always have one of my patients come back, or I do a follow-up, even if I say, oh, when I look at them and when I test, I'll say, well, I think it could be this, and this is what it means, but I want you to come back next week. So, and bring your partners if you feel like it's something to talk about. Now, if somebody comes in and they're alone, and then like the test comes out positive again, I personally do not like to just tell them on the phone. I like to see them, so then I can actually be present for them as they are adjusting to it. But oftentimes I need 2 points of contact, like the first time where they could kind of be in the shock phase, and then the second time when we can actually be discussing and referring, and there's so much more open to hearing, like you don't remember the podcast, right? So this way I don't just hand people a pamphlet and have them go out the door. And this is something that I talk to other providers for, because I do teach other providers how to do this, how to communicate, and always have 2 points of contact with all infections, not just herpes, because the first time you hear something, it's a little bit of a shock and you shut down. So we need to work on a person's nervous system and recognize that it's not just a 15-minute in and out the door. We have to be human here.
That's such good advice. That's so true.
Looking over at the chat, it looks like we're sharing a lot of resources. People have questions about clinical trials. Does anyone know of any clinical trials that are active or coming up, or how do we be on the lookout for these? It's a really good question.
Clinicaltrials.gov, and I think Anna Wald is with us, and we are so fortunate to have her, because we all have learned so much from Anna. So it's so glad to see you. Yay.
Anna, I
She
saw
was
you raise your
the
hand
one.
earlier. Yeah. Did you have something to say?
Well, I did, but then Ina and Terry said it, so I actually didn't have anything to add. But clinicaltrials.gov is a really good place for people interested in clinical trials, and you can search by both the type of study you're interested in, whether it's vaccine or antiviral, as well as by site, so where you live. So that's what I would recommend. I think that's the most appropriate source. And there are Assembly Biosciences will have many trials hopefully coming up in the next few years. And I know that the pratilavir makers are looking at, the possibility of extending the use of the drug in other populations as well. So those trials might also be coming up.
And then a question, would this advocacy organization also then sometimes be making announcements, for example, if they're looking for recruiting for a clinical trial? I'm just not sure about that, because that could be one other avenue. Obviously, everybody who's here on this webinar got the information somehow.
Oh yeah, whenever I get the information, I share it. I try and put it out through the Something Positive for Positive People network, as well as the newsletter, website. We have ads that we're running, everywhere. So whenever I find out about it, I look for it to make sure it's legit, and then I share it with the general population. One thing I want to note here is that Something Positive for Positive People is taking ongoing responses for a survey where people are able to share their experiences. We're learning things about people's experiences with outbreaks, their experiences with stigma. We're learning about demographics. Unfortunately, we don't get a lot of men who take our surveys. So we're really pushing the envelope to get more men involved with these surveys. So I linked that into the chat here as well. So If you're dating, if you're in a relationship with a man, if you know a man, love a man that has herpes, please make him take this survey because it's not representative of the population in general. And I know a lot of the women and femmes and non-binary folks are not just giving herpes to themselves. Okay. And now we have about 5 minutes left. One question I see here. So I've gotten through all of my questions, and I'm glad that we opened up the floor to be able to take the questions from the chat here. I want to address this question here. What can we do on a global level to destigmatize the virus? Protest. I believe that this is a very powerful step one, just being present in spaces like this, because what I generally see is that when we're able to say, here's how many people are wishing for some change, we want something different. And when there's collective advocacy, collective support, we have the numbers, we can collectively say, hey, here's the change that we would like to see. And then we can start to demand it. Being able to say we have this many podcast listeners or this many people who've taken our surveys, this many people who've shown up to our panel. This is how we start to gather momentum and numbers, and that naturally draws in more people who might be on the fence about whether or not to get involved. But it's these micro steps of just showing up for a panel discussion here or showing up where there's discussions about HSV, especially in the public sector. I know that that's a huge step for some people. And like I said, there's 72 people in here, and it's awesome. People have been trickling in and out. But just knowing that we have so many people behind us offers momentum to the advocates and the people who do work in this space. It keeps us going. It keeps us from burning out. And we have such awesome leaders in the public health field as well, who are willing to volunteer their time to be part of this discussion and offer their experience and expertise. So I want to just thank each and every one of you all for being here, as well as the audience members. And I want to just give each of you an opportunity, maybe a minute, to let people know how they can connect with you, how they can find you, and if there's any closing remarks that you have before I close us out of here. We can go in alphabetical order. Let's start with Eveline.
Well, I think my maketimeforthetalk.com is all my resources on the STARS Talk. There are free resources on there, a TEDx Talk, and everything else. And yeah, that's the best place to find my work. Thank you so much for inviting me, and it was lovely to hear all this information and to be part of this panel.
Thank you. Hannah?
If any patients that are wanting to reach out and just need support from another patient, I'd be happy to be in contact. My email, I can put it in the chat. But yeah, thanks guys.
Thank you. And then Ina?
Yeah. And Hannah, are you on Instagram? Do you have a HSV related account on Instagram? Okay, just curious.
No, no, I don't. Sorry.
Okay, no problem. You feel free to I put out content that's mostly geared, I would say, towards patients, but has some interesting information there for providers as well on Instagram at Ina Park MD. Give me a follow.
All right, Terry.
I would say that if you have been tested at Quest and you have no symptoms ever, and you have a positive test, and it's less than 5, although I've seen false positives as high as 17, lots of 12s, lots of 10s, false positives, do a better test. Just find out for sure.
And then Terry, how can we find you?
Westoverheights.com.
I'm going to type that in here for you.com. All right. And again, I am Courtney Brame. I'm the founder, executive director, podcast host of Something Positive for Positive People. It's a nonprofit supporting people living with herpes. We host support groups on Mondays at 7:30 p.m. Eastern Time virtually. There's workshops, events on navigating the discussions around sexual health with partners. I have the podcast. We're almost at episode 400. So I'm always looking for guests. If anyone wants to be a guest on the Something Something Positive podcast and just share your experience. That's a very useful way of just getting your story out there and allowing for someone to maybe connect with and resonate and offer that emotional support in a very safe way. I want to thank all of the directors of Herpes Cure Advocacy. Please visit www.herpescureadvocacy.com and you'll be able to see about any more upcoming events. This was a great first, this is our first collaboration together. So I want to just take the time to thank all of you for organizing this and bringing me in to be a part of it. I am appreciative of everyone for making this happen and bringing this all together. All right. Till next time. Well, this is not a podcast. I say that, but everybody take care. You are all dismissed.
Bye,
Thank
my
you.
colleague friends. Bye, Miss
Bye, everybody.
Evelyn, Hannah. Bye.